A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Today topic is inferior alveolar narrow block. In this video we'll talk about inferior alveolar narrow block and lingual narrow block, and we'll see it practically how to perform it. What is the injection technique? Before starting the video, such video must subscribe the channel and click the bell icon so that you will get video notification. Let's start. I will tell you technique that how to inject. Before that, let me tell you something about this. I will make a long video especially on theoretical type. In this video, we will only discuss the required thing that help in injection technique. So first of all, injection alveolar narrow, branch mandibular narrow, which is itself a branch of trigeminal narrow. Mandibular narrow is the third branch of trigeminal nerves, and inferior alveolar narrow is the branch of mandibular nerves, which is spread each on left and right side to different one. Some patient you have to remember to give inferior alveolar narrow block. These are not from the book, but if you remember these points, it is easy for you give block. If you are beginner, students must follow these points. First point is inferior alveolar narrow block, means opposite side of the corner of the mouth, means if we inject left side, so will enter from the right side, means from the right of the mouth, and if we inject right side, so will enter mouth of the left side. You have to remember this first point. Second point is the greatest connectivity of the rams of the mandibular. We have to feel greatest connectivity of the mandibular, then we have to detect the buccal fat of pterygomandibular. Raps is their elevation. Seen there is the pterygomandibular raps and depression present. These we call the pterygomandibular depression. We inject element of that. You have to remember this point. Then the third point is about needle. We have to use the long needle. You have to use 25 to 27 gauge long needle, and when we inject, needle must go 20 to 25 mm. Then we have to inject. Listen carefully, you will able to connect with this thing. If you are beginner, it will happen to you. Whenever you inject from IANB and you go inside just little bite like 1 or 2 mm and needle lets the bone, so this is wrong technique. You take it out and again follow the proper procedure. Unless 20 to 27 mm goes inside, it means we give wrong IANB. So you have to remember this part. Number 4 point is aspiration. Must remember this point. And any not only for IANB, whenever you insert the needle, so before deposit the solution, you have to aspiration first for ensure that needle is not anywhere. Don't deposit solution. If aspirate is positive, deposit only. When aspiration is required, this is very important. Suppose you are given injection by following then proper procedure, even after think. If needle is not the right required position, Even then there is no big problem whenever solution deposited. Learn read it properly first, then only apply it. So keep these points in mind, so it will easy to understand you. Also when you apply it, it will be easy to you. It's understand it practically. First of all, clamp to the injection site with cotton and spirit. Then we have to feel the greatest connectivity of the mandibular like this and will greatest buccal fed. As I told you before, site of that hair is pterygomandibular depression. One more structure is here, that is retromolar triangle. Watch carefully, we have inject hair from the opposite side of the mouth. When 20 to 27 mm needle go inside, it's like the bone without and straightly, then we aspirate and will deposit the solution. Then for lingual narrow block, take it out straightly and will change the position. See like this, in this way will comes, in this way will come straightly, don't remove all middle, so that there is no need to frict twice. Now insert it straightly, aspirate it, then deposit, then solution. This is the lingual narrow block. That all for this video. If this video was helpful to you, so must like this video, share it with your friend, and write in comment section how did you like the video and in which topic you want more videos. Must subscribe before game. Will meet soon in the next video. Thank you. Allah Hafiz.